Diabetes occurs when glucose, the body's main energy source, builds up in the bloodstream. Insulin, a hormone made by the pancreas, helps move this sugar into the body's cells. But in diabetes, the body either doesn't produce enough insulin or cannot use it effectively. As a result, glucose stays in the blood instead of being converted into energy. When diabetes is not controlled, sugar levels remain high, a state known as hyperglycemia, which over time can damage nerves, blood vessels, and several vital organs. Symptoms include excessive thirst, frequent urination, tiredness, blurred vision, and slow healing wounds. But many people notice nothing until complications appear. Diabetes appears in several forms. Type 1 diabetes is an autoimmune condition where the body does not produce insulin. It usually affects children and young adults. Type 2 diabetes often develops due to insulin resistance, commonly linked to obesity, inactivity, stress, and diet. Hormonal changes during pregnancy cause gestational diabetes, which needs close monitoring because it affects both mother and the baby. Doctors diagnose diabetes through fasting glucose tests, random blood sugar checks, HbA1c tests, and oral glucose tolerance tests, which measure how the body responds to a sugar load. In a fasting blood glucose test taken after 8 to 9 hours without food, less than 100 milligrams per deciliter is normal. 100 to less than 126 milligrams per deciliter indicates prediabetes, and 126 milligrams per deciliter or more on two tests confirms diabetes. For the A1C test, less than 5.7% is normal. 5.7% to less than 6.5% signals prediabetes, and 6.5% or more confirms diabetes. A random blood sugar reading of 200 milligrams per deciliter or more, along with symptoms, can indicate diabetes. Similarly, a 2-hour oral glucose tolerance test result above 200 milligrams per deciliter also confirms diabetes. Obesity, lack of exercise, high blood pressure, high cholesterol, smoking, and genetics all sharply increase diabetes risk. Uncontrolled diabetes damages blood vessels and nerves, leading to heart disease, kidney failure, infections, vision loss, and even amputations. Treatment includes medications or insulin, balanced meals, regular exercise, and routine monitoring to keep blood sugar in a safe range. While type 1 diabetes cannot be reversed, early type 2 diabetes and prediabetes can often be improved and even brought into remission through weight control, regular physical activity, and diet changes. Early action makes the biggest difference. Prevention rests on healthy eating, staying active, managing weight, reducing stress, and getting regular screenings, especially for those at high risk. Diabetes is not destiny. Early testing and lifestyle changes can stop diabetes before it starts and protect the heart, kidneys, and vision for life. Harshita Oberoi's report, Wellness Watch, TT India.